Good afternoon. My name is Walt Mabe, and this is the second of the weekly meetings for the Warren County Emergency Management Team. We're dealing with the virus, as everybody knows, and the purpose of the meeting is to keep Warren County citizens informed. We're adding new information to the county website every day or so, and it gets bigger and better every time that we're doing it. The county website is warrencountyva.net. You can find out what's going on with the virus and what you can do. The other thing that we're doing is we're asking you to help others. Not everybody that you know of has access to the internet, but you do know people that are your neighbors, they're your friends, they're your associates that may not have the internet, but they need to be spoken to and talked to and told what they need to do, especially for the just the simple things that everybody is trying to do, which is we've covered them over and over and over, and I'm glad to see that it's helping us. And those are: stay at home if you're sick. If you're out and about, keep a distance of 6 feet apart. Cover your mouth and nose when you sneeze. Wash your hands with soap and water for 20 seconds. Finally, clean and disinfect the areas of your home you frequently touch. I can't emphasize how important this is. It helps us to maintain the distance that we need, and these are the medical requirements that everybody is looking for us to do. So do what you can to help each other out. We're going to have several people with us today. One being Dr. Green. Dr. Green will be talking about the medical issues. We'll be also talking with Melanie Shepard. Melanie is the assistant superintendent for the school board, and she's going to talk to us about the meal programs that we've got for the kids. They're both exciting. We're going to have a question and answer session afterwards, and we hope I want to say I hope you enjoy it, but I hope you learn something. And if you learn something, pass it on. So without passing any more information on from me, I'm going to turn it over to Dr. Green and let him talk about the medical issues.
Thank you, sir. And you stole a lot of my thunder. You gave out a lot of good advice already. And by the way, a lot of that advice, particularly the hand washing and the personal hygiene and the properly covering your coughs and sneezes, don't stop doing that once this coronavirus outbreak is over. When this pandemic is over, we got a flu season to look forward to next fall, and all that advice is helpful in stopping the flu. In general, as of earlier today, in the United States, there were roughly that better? There were roughly 225,000 documented cases of coronavirus, COVID-19 in the United States, with roughly 5,200 deaths. So that's about a little more than 2% of the cases, the number of cases that we saw, and it ended up with deaths. That's a crude count. We're not really tracking cases, but that's just kind of an estimate of how bad the given disease is. It also gives us an idea of how we're doing over time. That number has been climbing slightly. It was 1.3, then 1.8. Now it's a little more than 2. But we can also compare it to other places in the world where most of the countries in Europe, for example, their case fatality rate, which again is the number of cases in a population during a given time, the number of deaths in a given population during a given time divided by the total number of cases. In Europe, those numbers are 6 and 7 and 8 and as high as 11 in Italy, 11%. The only country that's major country that's significantly lower than us in Europe is Germany, and their case fatality rate is running about 1.2 or 1.3% right now. But in France and in the UK and the Netherlands and Belgium, it's all 6s and 7s. Spain, I believe it's 9. So it's bad here, but it's worse in Europe. In Virginia, as of 5 o'clock yesterday, when the tally was put together, We had 1,706 documented lab positive cases. We had 246 people in the hospital and 41 deaths total in the state. While that's a lot less than New York City, it's still significant for us. The case numbers are still rising rapidly, probably through a combination of new infections and also the discovery of existing cases. We got one positive test back today that actually had been drawn on the 22nd of March. Some of the private labs are still working through their backlog because this testing has come online fairly recently. Of the 43 positive cases in this district, and the Lord Fairfax Health District starts down in Page and Shenandoah County and goes all the way north to the West Virginia line, everything west of the Blue Ridge. We counted 43 positive cases this morning, and 4 of those were from Warren County. And it doesn't mean they were detected in Warren County, it just means the people lived there. You can feel very sure that that's just the tip of the iceberg, and there are many more than 4 cases of COVID-19 here in Warren County. And that's important to keep in mind as I discuss some of the other facts. Throughout the district, so we counted 23 men and 20 women amongst those 43 positive, so about equal division between the sexes, and the majority of the cases that we found were between the ages of 40 and 70. But we did find them as young as early 20s and as old as well over 80. The health department's epidemiologists and public health nurses are endeavoring to track and follow every likely contact of all the positive cases. So once we find out a positive case, my nurses will be contacting as many people as they can to try to find out who might have been actually put at risk for infection. And those people then will be appropriately tracked. A lot of times they'll get a recommendation, well, you should self-quarantine, or you should do this if you have symptoms. But we'll look for people that are likely contacts. As the case number grows, we may not actually be able to do that anymore. And as the case number grows, we need to work more toward what we call a mitigation. So a general prevention behavior against this disease. And we're really exhibiting it in this room. So we've limited this room, which might otherwise be full and other times, to 9 people. Governor said no more than 10, here we are at 9. We're all 6 feet apart, so everybody stretch their arms out. Nobody can touch fingers, that means you're more than 6 feet apart. The reason for 6 feet is if I have the virus and I'm putting out viruses, by the time they get 6 feet from me, they're likely to be sufficiently dispersed that there won't be enough of them to infect anybody else. Okay, that's the purpose of the 6 feet. The virus scatters. It scatters beyond a certain point, it doesn't infect somebody. Also, the viruses dry out the farther they get from you. So we're following that recommendation, that social distancing here. The best way for most people, obviously, is to stay home. You want to decrease the number of opportunities to pass the virus. If you can, stay home. You hold meetings online if you can. If you do get together, you exercise the sort of social distancing that you can see in this room. I'd like the opportunity, if I can, to read a passage that I've put out on social media and also to the governments earlier today, but I think it's a summary of what we ought to be doing right now. Starts off with a quote. Each of us has the power, through our own choices and actions, to save American lives. That quote was made by our president last night at his evening briefing, pardon me. That quote is spot on, and I think everybody should keep it in mind that your own actions can affect the lives of others, particularly right now. This virus, this COVID-19 virus, can't survive on its own. It has to live off of human respiratory cells, and it can only survive in one person for a couple of weeks before that person's immune system destroys it. If it can't jump to a new person, it's finished. This is its weak point, and we must exploit that weakness to defeat it. We need to take away its chance to make that jump. Each of us has that power. This virus is sneaky. Many people who get it have few or no symptoms and don't know they can spread it. So we all must use our power. And indeed, research shows that up to half of the people infected with the virus don't have any symptoms at all. Minimize the number and duration of close human contacts outside your household. That's the ticket to victory. Stay home as much as possible. You can't infect new people from home. Stay 6 feet away from others if you're out. The air disperses the virus over distance. Get exercise, but in individual sports. Walk, run, cycle, hike, keeping your 6-foot distance. Don't be a vector. Avoid unnecessary travel, especially from a high-risk area to one of low risk. If you're starting to feel sick, absolutely stay home. If you think you need to be seen, call your doctor first if you can. Use the ER if you think you might need to be in the hospital, but still try to warn them before you show up. Stay away from the elderly and the infirm, but call them, Skype them, text them, let them know you still love them. Loneliness is a real problem when we can't be together. And of course, cover coughs and sneezes properly and wash your hands frequently. Please don't hoard. Have 1 to 2 weeks worth of food at home, but please only take what you need. If we do all these things for the next month, most of the infections we have now will be gone. We Americans have gotten through a lot before, and we'll get through this too. Each one of us has the power, but we all have to use it together. May we all be safe, healthy, and blessed, and we'll spend lots of time together once this is over. We're Americans, we'll get through this. And I'll take any questions.
Well, I have a question about, do you know anything about the case that was within Valley Health, or how many employees at Valley Health tested positive for the virus?
I don't know a specific number, and you really probably should contact someone from Valley Health for that information. Healthcare providers of any level, particularly frontliners like EMS, but also the emergency room staff and the hospital staff are all at high risk from this because they see a lot of people and a lot of sick people. It's inevitable healthcare providers are going to catch this, and we do know of a few, but they're not limited to one particular area. So their one high-risk group is healthcare providers, and we try and do very rapid turnaround lab testing on them. Another is anybody that's around large numbers of elderly people, particularly long-term care facilities. A third is people who are cases rather that occur in clusters. So if we see a large number or several cases in one place or in one facility, we're certainly likely to investigate that more closely as well.
There's a perception by a lot of people that in smaller communities with lower numbers like this, that all these precautions and the closings of businesses is an overreaction and an overreach of government. Can you explain perhaps why this isn't just another flu? Are there contagion variables that make this potentially much more dangerous than the average flu?
The first thing that's different between COVID-19 and the flu is it's a lot deadlier. Remember, I said that our case fatality ratio, our number of deaths divided by number of cases, is a little over 2% now. With the flu, it's about 0.1%. So if those numbers hold, it's 20 times deadlier than the flu. That's probably enough right there. The second is, it's April, the flu season is petering off. We'd love to see COVID peter off, but it hasn't right now. Our number of cases is still rising rapidly. The good news is it's not rising exponentially anymore. The curve's not going up like that. It's doing more of this now, but it's still a steady rise. Until we see it level off and start to descend, we need to pretty much do everything we can to stop its spread. And since there are so many people without symptoms that have it, there's no way to tell who's got it. We can't do 300 million tests all at once. So we don't know who to stay away from and who not. And for that reason, we have to practice a general, the social distancing. We have to practice that in general. it works best if everybody does it at once. Now, if you're in western Kansas somewhere and you're a farmer, pretty easy to practice social distancing. You don't see that many people anyway. Are there likely to be a lot more cases of this with people crammed together? You bet. It's one of the biggest reasons New York City's having such a problem. If you've ever been to New York, it's one of the most crowded places in the country, if not the most. So remember, it's the closeness of your contact. It's also the number of contacts you have. So the closest of the contact is why we say 6 feet, to let the virus disperse. And the number of contacts is why we say no groups bigger than 10. The 6 feet and the 10 applies whether you are in New York City, whether you're in Front Royal, or whether you're in Abilene, Kansas.
Again, Roger Bianchini, Rural Examiner. Is there any statistical way to estimate from the number of confirmed cases somewhere to the number of actual cases? Since, like you said, not a lot of people are getting tested proportionally.
Yeah, I'm not aware of any specific data that would allow more than just a speculative answer there. But I mean, if you figure half the people are without symptoms, you can probably at least double it. Because we're not testing people that don't have symptoms. But it's probably much more than that, because there's a portion of the people that do have symptoms that might just think they have a cold or even allergies and not realize they're sick with the COVID virus. And that data comes from two places I'm aware of. One is the Diamond Princess, where out of 3,700 people on that ship, 710 of them caught the COVID virus. Of that 710, 330 had no symptoms. It's almost half. Now, similar data coming out of Iceland, where they did a lot of testing and have a good idea of their population.
Now, for the people that don't have any symptoms at all, is it also the 2-week period where it's gone after 2 weeks, or do we know if it lingers longer than that, or does it just stay in them?
That's a good question. Again, we don't absolutely know because we don't know who those people are and how to follow them. The other thing that we're still working on is a good antibody test, what we call a serology test. So the test we have right now detects the RNA, the nucleic acid from the actual virus. That tells you if there's a live virus in your body somewhere. But what we're still working on is an antibody test, and the antibodies show up after a person is recovering. If you have antibodies to the virus, the presumption is you have some immunity to it and you're over it. So we need to have both of those available to answer a question like yours. I think the serology test should probably be coming available in the next week or two. And at that point, the other thing we'll be able to tell is somebody's over it and they have antibodies, they can go back to work.
And Dr. Green, are we thinking then that once you've had it and you've got over, it's going to be like other things we've had, like the flu, where you build up an immunity to it? Do they still believe that?
It appears to be that once a person is finished with it, they develop immunity and they shouldn't be getting it again. Not clear exactly how long that immunity will last, or to what extent it's there, whether it's in 99.9% of people or 80% of people, not absolutely sure. You hear anecdotal cases of somebody getting the disease twice, 1 or 2 or 3 reports of that. Not sure exactly if it was the same disease, hard to say, but the overall picture is it looks as though once you're over it, you're done and you're immune. And again, the goal of social distancing is for all the people who are sick to not give it to anybody because they're not close enough to anyone to give it. They all get over it, they all become immune to it, and when you're finished, all you've got is a bunch of immune people and a bunch of other folks that are not sick. No more pandemic.
Last question for me. So are we looking at this on a yearly basis? Is this just this is going to be a new season, Corona season?
The answer is maybe.
Maybe.
There's a lot of I don't knows, if I'm going to answer your question honestly. So other coronaviruses, and there's 7 different coronaviruses. We've known about 4 of them since the 1960s, and those 4 just cause common colds. And they tend to run seasonally. There's not a point where you never see the virus. I mean, you can still get the flu in the summer. It's just pretty rare. But there are seasons where the virus spreads much more readily. And it is possible that once the weather starts getting stickier, that this virus will not spread as well. It is possible that it may come back in the fall and go after the people who haven't had it yet. If you want to be negative, it might mutate between now and the fall the way the flu does, and it might be a little bit different. By the time, I heard today that there was some hope there might be a testable vaccine by sometime in the fall. That would be really fast for that to happen. But it is possible. And it depends, again, how bad the final effects of this virus are and how much risk we're willing to take with a only partially tested vaccine. Typically, it takes a year to 18 months to get a vaccine out from a standing start.
Isn't that because some of the people, you kind of build these vaccines from people that are immune to it? Or have this immunity?
That's different. That's we call that convalescent serum. So that's the blood and the fluid of somebody who has actually gotten sick and developed antibodies. So that you can actually, there are some experiments using that and actually giving it to people who are sick. We do that with people who have been bitten by rabid animals. We take serum from people who are immune to rabies and we inject it into that person to help fight off the rabies right away. But so that's a little bit different. What we're looking at is something that's usually it's crumbled up surface proteins from the virus. So without the nucleic acid center that allows it to reproduce, just the surface part, and that's what the antibodies will attack. So you give that to somebody, your immune system says, this is not normal, this is not part of me, and it makes antibodies against it, attacks it, and destroys it. And then the immune system remembers that, so when the real virus shows up, it comes back and says, I remember you, I told you to get out, and I meant stay out, and you don't catch it again. So, but in order to develop a vaccine, you have to number one, come up with a vaccine that works. Then you test it in usually mice to make sure it turns their immune system on and protects them. Typically, then you test it in a non-human primate, rhesus monkey perhaps. Then you do a safety test in a very small number of humans. Then you do a little larger number of humans and you measure their immune response. And then finally, you're ready to try the clinical trial, the phase 3 clinical trial. At least 18 months for all of that, in most cases. And we do that because we want something safe. We're going to immunize 100 million people, and it has a 0.1% bad outcome rate. That's 10,000 people. No, that's 1 million people. No, yeah, that would be 100,000. 0.1% of 100 million would be 100,000. That's a lot of people that have a bad outcome. That's not something that the United States would tolerate, nor should we.
I actually do have one more question. Once this virus gets in your house, how hard is it to get out of there? I mean, because it seems like it just goes from surface to surface.
Yeah, it doesn't really go from surface to surface. So if,
Dr. Green, could you repeat the question? 'Cause
yeah, I'm sorry. The question was, how long does the virus hang around in the house? If somebody coughs right here, and I do this while I'm talking to you, and then I touch my eyes, nose, or mouth, I could easily infect myself. That's why you wash your hands, that's why you don't touch your face, all right? This stuff only grows on respiratory cells, which are found in the eyes, nose, mouth, and then in the larynx and trachea and lungs. This virus can be detected off of a surface, sometimes for a day or two. Not sure whether it's really infectious during that whole time, but it doesn't jump off here and go over here.
Well, say if you touch the desk and then you touch the sink, it does go between.
Every time you touch, there would be a substantial decrease in the number of viruses that would make the trip.
Okay.
So probably if I touched this and then touched over here, I'm not sure if I would move enough to actually make this infectious. You know, it's not one virus that infects you, it takes a certain number of them. And that's why, again, standing more than 6 feet away, the farther away you are, the more attenuated, the more dispersed the viruses are, and the less likely you are to get infected.
Any other questions? Thank you, Dr. Gray. Mrs. Shepherd?
Thank you, Mr. Mabe. Warren County Public Schools is providing breakfast and lunch to Warren County children. We started this program on Tuesday, March 17th, serving student meals at E. Wilson Morrison Elementary School. A week later, on Tuesday, March the 24th, we expanded our meal program to deliver meals via our food service van to 6 additional locations. On Friday, March 27th, we again expanded our meal program to 13 additional sites by delivering meals via school bus. We are delivering breakfast and lunch to students on Monday for Monday and Tuesday, on Wednesday for Wednesday and Thursday, and on Friday, we are providing breakfast and lunch for 3 days, which would include Friday, Saturday, and Sunday. Last week, our feeding program served 2,100 meals. On Monday, March 30th, we served 804 meals at E. Wilson Morrison Elementary School, 276 meals via the food service van, 636 meals from our buses, for a total of 1,716 meals. On Wednesday, April 1st, we served 2,382 meals to 597 students. We served 1,088 meals at E. Wilson Morrison Elementary School, 332 meals from the food service van, 968 meals from buses. The following list are the sites for the meal delivery. At E. Wilson Morrison, we serve meals Monday, Wednesday, and Friday from 11 a.m. to 1 p.m. Our food service van delivery is on Monday, Wednesday, and Friday. Our first stop is at Ressie Jeffries Elementary School from 11 a.m. to 11:15 a.m. We then go to Royal Arms Apartments from 11:20 to 11:35. We then venture to Royal Hills Apartments from 11:40 to 11:55. We move on to Skyline Vista Apartments from 12:10 to 12:25. We go to Front Royal Church of the Nazarene from 12:30 to 12:45. And then we end up at Brinklow Road from 1 to 1:15. Our bus delivery is also on Monday, Wednesday, and Friday. We have 5 buses, and the first bus goes to Lakefront Royal at 11 a.m. They move on to Reliance Methodist Church at 11:45. Our second bus goes to Dismal Hollow Kiss and Ride at 11 a.m. We move on to Apple Mountain Bus Loop at 11:30, and we end up at the Friesland Mountain Thompson Kiss and Ride at 12 noon. Our third bus goes to Shenandoah Shores Fire Department at 11 a.m. We then go to Venus Branch Old Oak Bus Loop at 11:45. Our third bus ends up at North Warren Fire Station at 12:15. Our fourth bus goes to Rivermont Fire Station at 11 a.m. and then we then go to Fort Smith Fire Station at 11:45. Our fifth bus starts out at Fletchett Road, Skyline Trailer Court at 11 a.m. We move on to Browntown Community Center, South Warren Substation at 11:20, and we end up at South Warren Fire Station at 11:45. We also started an emergency child care program for the community's essential personnel. The program is for children ages 3 to 12. Essential personnel includes first responders, healthcare workers, and others who help maintain the health, safety, and welfare of Warren County residents. There is no charge for this program, however, the space is limited. We started that program today with 27 students, and we are looking to start a second program as soon as we find enough staff to staff the program. So be happy to answer any questions.
Ms. Shepherd, describe these meals. How are they boxed? What are they consist of? And who can get them?
So any child age under 18 and younger can receive the meals. And something we learned yesterday from the Virginia Department of Education was the student does not have to be with the parent when they come to pick up the meal. So the parent just has to provide the student's name, and then we're able to deliver 3 meals. The breakfast includes non-perishable type items that students like to eat, and then the lunches include sandwiches, fruits, vegetables, milk. So it's a nice sized lunch and breakfast for students for 2 days.
Sounds like a Pop-Tart. What are they going to?
So I can't answer that question, but I am actually going to ride the bus tomorrow, so I'll be able to answer that question tomorrow.
All right.
Yes.
What's the easiest way for people to get that schedule?
So perfect. Thank you for asking that. The schedule's on our Warren County Public Schools website, but I wanted to read them here in case people do not have internet access. So, yeah. And hopefully the Royal Examiner and the NV Daily will publish those times and locations as well.
We might do that.
Yes.
And that's going to keep on through the summer, the meals, that goes all summer, right? Is it
So
the
we
same schedule?
we anticipate that the delivery schedule that we currently have will continue through June the 10th, which is the governor's closure order. But we do provide meals throughout the summer. Our food service does that as well. So we do plan to continue it, but maybe we're not sure what the sites will look like at that time.
And not really related to anything you said. How are kids? Are they students still getting graded on things? How is that work? Is it all just online and they're getting graded? Or?
So that's a great question. We have students who are working at home. If they have internet access, then they are working virtually. If they do not have internet access, then we are providing learning material via the bus routes, or we've mailed stuff to parents. We've had parents pick up materials. But our teachers have office hours in the morning and in the afternoon, and they can communicate, students and families can communicate with our teachers via phone or email any weekday.
Okay, so even though schools are closed, classes aren't just
Right, even though
completely
schools are closed, we're still providing instruction, absolutely.
Are there any additional questions?
Thank you.
Well, as you know, the town and county are preparing for the long term, and I believe that everybody out there should too. This pandemic is going to take some time to get over, and the economic dislocation it's causing is going to take even longer. Every day we're working to improve services to residents here and help those who need it most. We'll communicate what we're doing and how we're doing it. I ask you to give us feedback on things you see that need getting done better. You can also do your part by helping local businesses survive that have been hit hardest by the virus. Every local restaurant has had to stop seating customers' order, and that is devastating their business. They're fighting back with a curbside service and using delivery services. If you can afford it, help a local restaurant or business. We need them to survive if our community is going to bounce back quickly when the spread of infection ends. I want to thank every one of you for listening. Spread the word. Help a neighbor. Practice social distancing. And visit the county website for updates. That's warrencountyva.net. We're going to get this through together. The town and the county are working together on everything that we can do to help make it better for all of us. Thank you.